December 4th through 8th is recognized nationally as National Influenza Vaccination Week. And joining me today to talk about the importance of getting your annual flu shot is Susan Adamson, Executive Director of the Blue Ridge Free Clinic. Thank you so much for coming in today, Susan.
My pleasure. Thank you.
All right, so anyone 6 months or older can get their annual flu shot. So why is it so important that people get that vaccine each year?
Well, it's really critical because it takes about 2 weeks for your immunity to develop after you get the vaccine. And we know that flu season starts hitting typically November on through the winter months. And so each year the vaccine is changed just slightly to try to match the strain of the virus that's going around that year. And if you don't get it for this year, last year's flu shot is not going to protect you.
All right. And there are obviously some groups that maybe are higher risk for developing complications if they do get the flu, such as children, pregnant women, we were talking earlier, elderly individuals.
Right.
So what are those complications they could face if they do get the flu this year?
Well, primarily the pneumonia can follow the flu if someone's body is not able to fight it off. That's what we see with hospitalizations, people getting pneumonia. Also, children can get encephalitis. They can get myocarditis, which is inflammation of their heart. And beyond that, people who have diabetes or other chronic health conditions may get dehydrated, severely dehydrated.
All right, and why is timing so vital to treatment, not only for anyone that gets the flu, but for those groups that are at higher risk for those complications?
There's a small window of opportunity for antiviral medicines to work. They work most effectively within 48 hours of the flu hitting or the fever starting or the cough starting. After that, the efficacy or the effectiveness of the vaccine of the treatment just drops off. And so we really want people who need treatment to come in and get the antiviral medicines within 2 or at the most 3 days.
Okay, and obviously people want to avoid getting the flu, and one way to do that, like we've been discussing, is that vaccine. So if folks want to set up an appointment, is there a specific way they should go about that? They can contact you all. How should they go about that?
Well, if you have a primary care provider, the best thing is to get your flu shot through your doctor's office, and people start giving those out in October, but it's not too late. We started seeing flu in the community just last week in our practice, and it's starting to soar, I believe, in the next couple of weeks. So going to your primary care provider's office, going to a local pharmacy is a place that you can get them. And we have quite a few vaccines left that the hospital provided to us, Centera provided to us, that we can give to our patients or anyone who comes in when we're open.
All right, obviously, very good idea if you haven't yet, as you mentioned, to get that flu vaccine, because the only way to protect yourself probably is to get that vaccine. Right?
Absolutely, it's really important.
All right, thank you so much for your time today, Susan.
Thank you.